Good morning. This is the virtual Board of Health meeting for Tuesday, November 10th, 2020. I'd like to start off with doing approval of the minutes for October 13th, 2020.
I'd like to make a motion that we approve the minutes as written.
I second that.
All in
Aye.
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 This conference will now be recorded.
Okay.
What's that?
I don't know. I never heard that before.
Sorry, I forgot to hit that earlier. That was my bad.
Oh, that,
I'm supposed to record it.
well, it looks like we don't have any new business listed. So we'll directly on to old business. Flu vaccine update, Stacy?
Sorry about that.
Cutting in and out.
So as you know, what, John?
She's cutting in and out. Kathy is. All right, that's all right. We'll figure it out.
Just to give you a status of the flu update. As you know, we purchased 700 doses and we've given about 520, and we have approximately 180 remaining. And so what we're doing is with that, it'll be every Tuesday afternoon. Katie and Nick will give it here in the office from 1 to 3. They just need to call. I'll give you the number. They need to call Jen and set up an appointment just to give them a time slot, just to keep it spaced, keep people spaced out. And it's 781-384-9197. And again, it's every Tuesday, 1 to 3 until the supplies run out. And we do anyone 14 and over.
You want to give that phone number again, Stace, please?
Sure. 781-384-9197. And if you don't remember that, you can always just call the town hall and ask to speak to the health department, speak to Jen in the health department.
Stace, one more question. Excuse me, regardless of insurance. If you don't have insurance, you can still come, correct?
Right. Anyone 14 and over. We don't
Thank
turn
you.
anyone away for lack of insurance.
Thank you.
You're welcome.
Okay. Can you hear me now without it breaking up?
Yes.
We move on to COVID-19 update.
So there were a lot of updates from last week, and a lot of it will merge also into my director's report. We've, continues to be pretty consumed by the pandemic. First, want to sort of talk about we continue to work with the schools, and it's related to a lot of the changes that that were announced last week. And the biggest one really was the change of the metrics that go into the color classifications of communities. And if I may, I'm going to actually share my screen so we can all look at it. 1 second here. So these are the new metrics that were issued on Friday. And you can see they are 3 categories based on the community population size. We obviously are in the middle one, between 10 to 50,000, Norwich population being about 30,000. And so this takes into account the average daily case count per 100,000, which is what was used in the previous classification. But it also takes into account the percent positive. So once your average daily case count goes over 10, then you're considered yellow, or if your percent positive is over 5. If it's over 10 and your percent positive is over 5, then you are considered red. So what that did was it actually lowered Norwich into the yellow category. I think it's a good idea to take into account more metrics when you're classifying in the community risk level. I think this might still be a little bit of a simplified method to do that, but I think it is good to include other factors. And it's something we've been talking about a lot in our reports, that our test rate is very good. Our percent positive is low. It's under 5. Last week it was 2.2%. So that continues to be low, and that is an indicator of, the ability to test, which is a positive indicator to what's going on the ground. So I think those things are important and good. It does change a lot of things on the ground, though, when we change those classifications, particularly with schools. In the same announcement, the administration at the state level, the governor's office, is really looking to encourage schools to bring back students as much as possible, while obviously sticking to the safety standards. The one of the biggest limiting factors for Norwood is space. I mean, we want to maintain those the 6-foot separation with the students in school, and we really don't have the space to bring many kids back and maintain that separation. So at this point, when we met with school committee, and you know, Kathy, if you want to add, we met with school committee, we just really advised to stay the course. We continue to watch the data. Our average daily case count in the community is rising. We are not seeing transmission in the schools, and that was something that the administration pointed to, that the more information we have throughout the pandemic, you know, locally, but also worldwide, is that schools are not a major source of transmission for the virus. And so they keep encouraging, you know, schools to stay open because of the great benefit of having kids in school. Obviously, there's a huge negative impact when you take kids out of school.
Is there going to be any type of fine if they don't put it back because they can't do it safely? You know?
Yeah, so we're, you know, that's a little unclear what sort of pressure the administration might put on communities. They did stress, so the safety standards do have a range, 3 feet to 6 feet. And they did stress in the press conference that, you know, 3 feet is also allowed. I think from our standpoint, you know, numbers are climbing. The hybrid is working. We've had several instances where we've had positive cases of school-age children, but they were not in school because of the hybrid model during their infectious period, so we were able to avoid additional exposures. And I think, you know, as the administration, as the superintendent, excuse me, sends out emails, it actually happens a lot that we have a school-age child, but because of either the hybrid or they're already in quarantine, that there was no exposure in the schools, which is great. That means the system's working. So the hybrid model is working for Norwood. It is reducing the chance of transmission in the schools. But that's a good question, Kathy. I don't know what type of pressure the state's going to put on districts to bring in more kids 4 days a week, or 5. Oh, I'm sorry. One more thing I want to add. They did bring up the point of the parochial schools and a lot of the private schools that are in 5 days a week, and they're not seeing a huge amount of cases there either. So, like anything, I always say this during COVID, it's a balancing act. It's, you know, the risk-benefit analysis, and that's not an easy analysis to do, particularly with school and kids and all the factors that go into it. It's a very difficult decision.
So, Sigal, you said, excuse me, Kath, you said 3 to 6 feet apart. We chose 6 feet. The state recommends 3 to 6. There's a range.
That's correct. So the guidance
I didn't know
that the Department of Elementary and Secondary Education issued out to schools, and this was since the beginning, when back in the summer when they issued their guidance before school opened, they always gave a range of 3 to 6. Most schools have kept to the 6. That is what we require in businesses, workplace environments. Everywhere else, every other business and workplace, we say 6 feet of separation, because that's when we know the chance of transmission drastically reduces when you're 6 feet and beyond. So that's why, you know, most school districts went with the 6 feet, because that's the safety standards for everywhere else. And, you know, what's the justification for lowering it in schools?
So it's not a universal law. It's because I heard Stoughton's going back and they're moving their desk 4 inches, and I thought, oh no, that's not legal. That's not right. But it is. Every town has their own discretion between 3 to 6.
Correct.
Thank you.
It's going to be a balancing act, Carolyn. We're going to have to sit down. Sigal and I are probably going to sit down with the school committee to try and come up with some parameters for them to help them get through this. They're going to have to look at the schools. I know it's probably not so much of a big deal at the high school, but I think the elementary schools are smaller, so that may be a difficult challenge to try. And we may have to go with the 3 feet in order to get kids back into school, but it's going to be a work in progress for now.
Yeah, well, I think we're pretty strong with the hybrid right now in the 6 feet. You know, I'm really very happy with what Sigal has said, and it's so far up to date with that. It's not stemming within the schools; it's being brought in. I mean, that's a big plus for our community. Just the community's got to tighten up a little bit.
And that's a great reminder that, you know, we could be perfect in the schools, but if people aren't doing the right thing out of school, not gathering, wearing their face covering, you know, if people aren't following all those safety measures out of the schools, then our numbers are going to continue to increase and it will impact the schools. And we've seen some of our neighboring communities where there has been activity outside the school that led to schools going to fully remote because of the number of cases in the school. So it's really important that all of our families just continue to be vigilant. And I know we're all very tired of these safety standards, and get a lot of pandemic fatigue for sure out there, but that we need to stay vigilant. You know, our case count is going up, but there are also a lot of positive factors like our percent positive and our testing rate and our more availability of hospital surge. And we are better staffed here at the health department to do contact tracing. So there's a lot of good indicators, but our numbers are going up. So I want to remind residents to continue to be vigilant with the safety standards and all those precautions that we constantly are reminding everybody of.
Well, we also want to let them know, Sigal, that Norwood Hospital is now open to do the testing. And they just have to call and get they call their doctor, and the doctor calls a special number that he has and sets up an appointment. But Norwood Hospital also has a testing now that's available to the public.
Yep, they've opened their testing trailer, which is in the parking lot behind the hospital, and they are testing. And a good thing, Nick and Katie have reported good turnaround rates on those tests. So I'm happy to hear that it's not only more availability of testing in Norwood, but it's also a quick turnaround. So very excited to have that.
Plus, it's a drive-through, so you don't even have to get out of your car.
Correct. Yeah,
that's a good thing.
So the other big announcement last week was the new stay-at-home advisory and updated orders, again, out of the governor's office. The stay-at-home advisory is asking all residents to really stay within their household from 10 p.m. to 5 a.m. Obviously, if you have emergencies or need to go to work or school, that is allowed. And this is an advisory. We're really asking people to do this. It's, again, trying to avoid those gatherings late into the evening where people might not make the best choices as far as their COVID safety standards. And along with that, businesses other than retail need to close at 9:30. That includes our restaurants to allow everybody to get home by 10. The restaurants can serve takeout after 9:30, but no service of alcohol.
Could you clarify that for the restaurants? Do you have to be out by 9:30, or does the restaurant have to stop serving food at 9:30? I mean, there's a half-hour leeway and there's some confusion with it because people say, "No, I can stay till 10. No, I have to leave at 9:30."
We want them to be close to shutting down at 9:30. If there's somebody finishing their meal and it's 9:35, 9:40, we're not going to push them out the door. But they need to probably not seat people after 9.
Oh, no.
Depending on each restaurant's going to be a little different as far as their time it takes to provide the table service, and that's going to be a judgment call on each restaurant. But we want to start heading towards closing those stores at 9:30 to allow the travel time for people home by 10.
How is this going to be enforced, Sigal?
So just like all the other orders, the health department and the police department have the authority to enforce it. But of course, it's a sort of progressive enforcement, sort of progressive discipline that we start with a warning. Either way we talk to the restaurant, just explain the requirements. If they continue to fight, we sort of go up to a second warning and then, a written warning, and then we can go up to a fine. There is a civil fine of $500. I'm sorry, that's for the gathering order. There are fines that we can issue if a restaurant or any business is clearly defying it after several warnings. But, and most of the businesses do the right thing. So it's really, we were able to resolve most of the conflicts throughout this whole pandemic with really a conversation. Had a couple instances where, there've been pretty defiant businesses that just are not following the safety standards, but say 90% of them want to do the right thing.
Okay, so with this mandatory closing of restaurants, has it changed the increase inside or outside or decreased the amount of people you can have in, or is that still the same in, there's so many things that come through that I read that I'm not sure how to define it. So I know the outside gathering. So for inside of a restaurant, does it still 6 feet apart? How many tables you can get in 6 feet apart?
Right. So the restaurants are limited in their capacity by distance. So they don't have a sort of percentage or number limit. They are limited by the number of tables or seats that can fit while maintaining that 6 foot separation between the tables.
Okay.
They can still have up to 10 people at a table. That has not changed. But obviously the 6-foot separation remains.
In functions as the holiday season comes in, the gathering for families I know it's 10 people inside a home, right?
Yep. So that's sort of the next update that I was going to get into with the revised gathering order.
All right, we'll wait.
No, I can go right into it now. So the revised gathering order is for all events. So yeah, when we think about more of a function or event, then this is where it would apply versus just regular restaurant seating. So at private residences, like Carolyn just said, no more than 10 people indoors at private residences, no more than 25 outdoors. So when you're having a gathering at an event venue or in a public space, no more than 25 indoors. And then because we're now in yellow, we are considered a lower risk community. We can have up to 100 outdoors.
So no more than 25 indoors.
Correct. And those actually haven't changed. Those are the same. It's the private residence that was updated with the new revised gathering order.
Now this includes, I'm sorry, this includes the people working there as well as the customers, or is it 10 customers plus the people working there?
It includes everybody there, so including the employees.
Okay.
So along with the stay-at-home advisory, all these gatherings need to end by 9:30. There is an exemption for religious and political gatherings. Just a distinction there on the religious gathering. So like a wedding ceremony is a religious gathering, but the party after the wedding would be an event and would be subject to the restrictions. Face coverings are required at all public gatherings, and that sort of goes to the next order we're going to get to in a second. And just to know, the host and the event venue may be subject to penalties, civil fines of $500 per violation, and each individual over the allowed number would constitute a violation. So if you had an indoor gathering at an event that had 30 people, you're 5 people over the limit, each individual person would constitute a $500 fine. So those fines can really add up is the point. Like I said, though, before, discipline progressive enforcement is always how we approach any regulation or order enforcement, but we really want to encourage everybody to abide by the orders, especially with our numbers starting to climb.
So more and more companies are putting up tents and closing all 4 sides with heaters in it. The legality of that is what?
Once you close all 4 sides, it is indoors, and you are subject to the indoor limits, so the 25 people. So if you have a tent with 4 sides and a roof and a heater, you're indoors. So if you're hosting an event, it needs to be 25 people.
So with 3 sides up, is that a lot? 3 sides up?
If 50% of the sides are open, so half, then that is outdoors. That is considered outdoor.
And what about these spheres that I see spiking up all over town? Some are in Walpole.
Yep,
so where is the ventilation in those? I'm pretty stupid with that. Do you see them? Everybody see them?
Yeah, well, we've actually, Angela and I visited one of them going up at Lewis's, and they do have ventilation up at the top, but pretty much you are, now we're switching from events again back to restaurant seating, so don't want to mix
I'm sorry, yeah.
But no. And, but just it's more for the public to understand there's an event.
It is.
There's event order, and then there's also the safety standards for restaurants. And sometimes it's gray on which category you should be regulating. But so these sort of dome tent things, Andrew and I looked at them. We went over the sort of safety precautions we should take. There are vents up at the top that we advise them to keep open as long as the weather's good. To keep the doors open as best as possible, get fresh air. That's always good to dilute if there is somebody that is transmitting in that party of up to 10 that could be in that tent. But really, once you put the tent up, it is technically an indoor environment. So restaurants can have people sitting indoors, so it's not like they can't use them. But from a public perception standpoint, you are eating indoors when you're eating inside a tent. They also have cleaning requirements, so the tent needs to be cleaned. The whole tent needs to be cleaned in between parties. In addition to any ventilation they can do, there are some, like I said, there's some windows up at the top that they can keep open, get some fresh air in.
So the tent at Lewis's has to be cleaned every day?
It has to be cleaned between each party, so multiple times a day.
Multiple times, okay.
Yep. And Angela and I went over those procedures with them.
Okay.
And I'm sure other restaurants will be looking to put things like that up, especially if they have more spaces, maybe some of the ones up on Route 1, you know, as we get into the colder weather. We're also hitting, you know, we don't know how long this outdoor seating, we're going to try and keep it going in the town as long as possible. But as we get into the colder weather and then we get into snowy weather, it's going to become more difficult. But especially with this restriction on closing, we understand, you know, it is going to be very hard for our restaurants. And as a town, you know, switching hats here from public health to a community leader, obviously we want to, you know, do everything we can to help our local businesses.
Are those tents permitted? Do you need a permit, or you just buy them and put them up?
They do need to talk to the building department and the fire department.
Okay,
There are some restrictions and requirements from those agencies. The last update is the face covering. So all persons over the age of 5 need to wear a face covering whenever in public, regardless of a 6-foot separation. Really just simplified the order. The original order said if you were, you only had to wear a face covering if you're within 6 feet of another person. But now it's really, if you're in public, you should be wearing a face covering. So pretty much you leave your house, you should be in a face covering. The other big change was that employers and schools can now require proof of a medical exemption. So if some employee claims a medical exemption to not wear a face covering, you can ask for proof, like a note from the doctor. And any violations of the face covering order is subject to a $300 fine. We just got off the department head meeting with my department head colleagues, and the police chief had a great idea. He's having, if they see somebody without a mask, they provide them with one. So, you know, rather than strict enforcement, what we really want is compliance. That's always the goal in public health, is that we want compliance. We don't want to fine people. We want people to abide by the orders and the regulations. So any way we can get compliance, that's the best way to go, and that's our goal. So I love the idea of see someone without a face covering, rather than slapping them with a fine or some enforcement action, just give them a face covering and ask them to wear it. Because again, that will get us to our goal of compliance.
That's a good idea. Okay, is that all for that update, Sigal?
I believe that's all the updates from last week. There were a lot of them, and we will continue to work to figure out exactly how they work. And I think, Carolyn, you brought up a great point of, you know, if somebody's seating past the 9:30, it's not like we're going to go around and start checking all the doors at 9:30 of all the restaurants, but that we want to obviously make sure people are vigilant with trying to abide by it also.
Well, there's no way that can work. It's you know, you just need a window of, you know, if they're just finishing at 9:30, you give them their bill and they're out at 20 minutes to 10. I mean, it certainly can work. And I'd say 100% people want to keep their licenses and keep their customers coming in. So that's something that we can all abide by.
Great.
Okay, moving right. Public health nurse report.
Hello, everybody. So a couple things that are good segues. I wanted to talk about first COVID, of course. So the mass.gov website has released some very good recommendations for Thanksgiving with regards to COVID, and residents can find that at mass.gov. The very top of the page, there's a big banner that says coronavirus with recommendations. But some of the basic principles I wanted to talk about were that what's considered a lower risk gathering for Thanksgiving and what's considered a higher risk gathering. Basically, the recommendation is that Thanksgiving be held with those that you normally have close contact with. So people that are already living in your household. Higher risk gatherings would be certainly those that you are not normally in, you know, your immediate circle of contacts or out of state travel. Also on the mass.gov website, you can find a list of states that currently are on the high risk state list and would fall under the restrictions under the travel order of needing to quarantine upon coming back to Massachusetts. Obviously, the states do change from time to time, so you should check the mass.gov website. But as of today, Connecticut and Rhode Island are considered high-risk states, meaning that residents returning, if they do go to a Thanksgiving gathering there, you know, and see family there, should quarantine upon coming back to Massachusetts or get tested and quarantine until they receive that test result within 72 hours of coming back from Massachusetts. That segues into testing. We sort of touched on the Norwood Hospital site already. So we do have that testing site up and running. That testing site is not a testing site you can just show up to, or there's not a number to call. The way that it works is if you have been asked by myself or Katie or another public health department to get tested because we have determined you're a close contact or you're not feeling well, you would need to contact your primary care doctor. And your primary care doctor would fax an order to the Norwood Hospital testing site, and the testing site will call you for an appointment. I do want to share that they've released the fax number publicly, so you could give it to your primary care doctor, speed things up. But the fax number for them is 781-278-4403. And again, your doctor would need to fax the order to that number, and then the site will contact you. And it is a drive-through, and we've been getting the results back fairly quickly, I'd say 24 hours. So that's good. We still have Norwood Urgent Care as well, right across from the Walpole Mall doing testing. You do not need a referral for that one, but technically the Norwood Hospital site is the only one in town currently doing testing. If any residents do need to get tested upon arrival and those sites don't work for them, you can always go to mass.gov/get-tested to find other places to get a test done. There are some sites that are run by the state. They're called Stop the Spread sites, where regardless of whether you have insurance or if you're just getting tested purely to get out of the travel quarantine order and you're concerned about, a copay or anything like that, if you go to a Stop the Spread site and you're a Massachusetts resident, you will not have to pay for it. So the next thing would be blood pressure clinics. So we've been doing the blood pressure clinics on the second and fourth Wednesday of each month at the senior center at 11 a.m. Important to note that tomorrow there will not be a clinic because of the holiday. Their next blood pressure clinic will be held on the 25th. And then the flu. So we did talk about this a little bit already, but we've completed flu vaccination clinics for DPW, the light department, all school employees, and we are running flu clinics at the town hall by appointment on Tuesdays from 1 to 3 p.m. While we still have until we run out. And residents can make an appointment directly with Jen at 781-384-9197. And then the last thing is that it's National Diabetes Awareness Month. So the entire month is for diabetes awareness. And it kind of brings me to an important point that all other health matters don't take a back seat just because of the pandemic. So this is a normal, diabetes screening is a normal thing to start doing basic labs for at age 40, or sometimes earlier based on risk factors such as being overweight or a family, or a family link. There are other risk factors that might start screening before 40. So it's still important that residents, if they have they've been putting off preventive care visits or something like that, doctors' offices are, have been dealing with, the precautions necessary for COVID for a while now. So we shouldn't be putting off preventative care during this time. Diabetes isn't going to wait for COVID.
Nick, my only thing is I just want to make sure that people out there understand that we do not carry the senior high dose flu serum.
You're correct. We do carry the standard, it's called quadrivalent, the 4 strain of the vaccine. We do not have the senior high dose. So if your primary care doctor for residents, if they've told you specifically to get the senior high dose, unfortunately, we do not have that.
Okay. Do you know where they carry it so that people could get it? I mean, is it something that the hospital would carry, or?
So my recommendation would be to contact pharmacy, the closest pharmacy to you. I have noticed that it's a little bit of hit and miss. So you might want to try a couple of pharmacies, because some pharmacies might have gone through their senior high dose, allotment already, and some may still have a lot on hand. I'll say, for example, my local pharmacy has tons of it on hand. So you want to really just call around and do a little shopping, but you should be able to get it at a pharmacy. And certainly checking in, with your primary care doctor if you run into any trouble. I mean, I'm assuming that your primary care doctor wouldn't be carrying it, otherwise they would have just given it to you anyways. But they should be able to help direct you to a place that has it in stock if you run into any trouble.
Great, thanks, Nick.
You bet. Any questions?
I have a question for Nick.
Sure.
Hi, Nick. Let's go back to the COVID for 1 minute with your PCP faxing over a request. I've been told the turnaround time is a little bit on the longer side, so they run up to urgent care. Can you define how long they said they'll get back to you?
So I have not heard of delays in once the fax has been done. That being said, if time is of the essence, I would advise a resident to check in with their primary care doctor. If has the order been faxed? Unfortunately, I'm not sure if this is going to change. I'm sort of hoping it does, but unfortunately, there is not a number for somebody to contact the testing site directly. So
yeah, that's what I understand.
Yeah, so your primary care doctor is really acting as the sort of liaison in this instance. So if for some reason you feel like this is, my doctor told me they faxed it yesterday morning and it's the next day and I still have not heard from this testing site, I would recommend that the resident contact their primary care doctor to see if they can speed things up a little bit. It is true that the Norwood Urgent Care, you do not need a referral. The only thing I would say is that I have seen pretty quick turnaround times for the testing at the Norwood Hospital site. So, but yes, if there was really a situation, they can go to the Norwood Urgent Care without a referral.
And when you speak to your PCP, and it is best to ask for a rapid or that PCR, is it PCR? What's the second one? What's the first one that they should ask for?
You definitely want to ask for the PCR test, and that one is the gold standard of all the testing. And I will say that the Norwood Urgent Care and the Norwood Hospital site, neither of them offer that rapid. It's called an antigen test. I do not offer that. So you definitely want to seek the PCR test. And a good point too, Carolyn, is that is the test to get out of the travel quarantine if you were under quarantine for travel, not a rapid test.
Okay, and that will get you out of work. I mean, that'll, if you traveled, all right, so it's the PCR. Okay.
PCR, important to note, that's for the travel quarantine. If you've been contacted by the health department and asked to quarantine because you're a close contact, we do recommend testing, but if, hopefully, obviously the test comes back negative, but you don't get out of quarantine if you are a close contact.
Sure.
That's strictly for the travel order.
Thanks, Nick.
You bet.
Any other questions? No? Okay, moving forward, Impact Norwood.
Thank you.
Nick. Aubrey?
Yes. Hi, good morning, everybody. I will keep my update brief. On October 19th, a new program coordinator, Francesca, started with us, and her primary role is working with the Youth Coalition. She's working on a recruitment plan, as a lot of our current youth ambassadors are seniors, so sadly we'll be losing them at the end of this school year. Our podcast, the Impaction podcast, is officially up and running. We have 3 aired episodes with another one coming this Friday. You can listen to those through our website, or they're available on music streaming platforms like Spotify and Apple Music. Last week, Francesca and I met with one of our steering committee members, Teresa Stewart, who's also the chair of the school committee, and Dr. Galligan, the high school principal, to discuss ways we can help support mental health of students at both the high school and the middle school. As we all know, with this pandemic comes mental health crisis. It's been really difficult on people's mental health. So we are arranging to have a few speakers come in and talk with high school and middle school students about positive mental health, positive coping strategies, and also reducing the stigma of talking about mental health. Let's see what else. We're working on a recruitment plan to engage more members of the community in Impact Norwood. So we have a tiered volunteer system so people can participate and help out with the coalition as time allows. So more information about that is available on our website, impactnorwood.org/volunteer. And I am currently working with leaders from coalitions in Avon, Easton, and Stoughton to collectively apply for a new substance use prevention grant from the state called Mass Call 3. Stoughton is applying as the lead community and Norwood would be a cluster community. So we would still benefit from the funding without having to worry about the logistics and managing the grant. So it's nice for us. And lastly, and this isn't on my written report because I just found out earlier this week that the Metro West Adolescent Health Survey, they have decided to hold off. They were going to implement the survey in December, but because of all the changes with the pandemic, they are postponing that survey until the spring. So normally we would have implemented in the fall in person, then it got shifted to December, and now they're hoping to implement in the spring. And lastly, our next coalition meeting is going to take place this Thursday virtually from 3 to 4 p.m. So if anybody is interested in joining, that would be a good time to join. So thank you.
Thank you all.
Yeah.
Can I ask you to invite Francesca to our next meeting in December so
Sure.
that we can her and she can join us too at the Christmas luncheon, but just so that we put a face to the name.
Yeah,
She might have to sit at another table if we get past 10 people.
Yeah, I can definitely see if she's available. This is actually a part-time job for her. She has a full-time job and she typically only works in the afternoons, but I think if I give her enough notice, she should be able to join us.
Great.
Yeah.
If not, that's, it's just like to put a face to
Definitely.
the name.
Definitely. Great.
Okay,
Thank you.
Okay.
Thanks,
moving right
Aubrey.
on. Angelo, Sanitarian Report, you're up.
Yes, good morning, everybody. I'll start off with the food establishment report. We had a mobile food truck permitted a couple of weeks ago named Paul's Canteen. He plans on working some of the dealerships on Route 1. As far as the pending locations you see on the bottom there, the only update I want to give on that is Happy Kitchen. They are no longer interested in opening that location, which was the old Bamboo Cafe on Washington Street. The landlord does have another potential buyer that will potentially take over that location.
Oh. Wow, they just put a sign up there.
I know.
Now, where it says spot, it says change the location. They're not near ready to open, right?
Not to my knowledge, they are not. No.
Okay. Okay.
Okay. Good. On to the inspection now.
Sure.
Sure. If the board has any questions on these establishments, just please let me know.
Okay.
We seem to be still getting a lot of COVID-related complaints. Do you think is it mostly men we're seeing, Angela?
It's
People not
mostly face covering complaints or non-compliance to the face covering requirements. The only non-compliant location I noticed was for Pizza, and they were given a written warning on the 20th of October because I did observe non-compliance to the face covering requirements. So the next time.
Who is that again? Who
Giorgio's Pizza.
is that
on
again?
Giorgio's Pizza. on
George,
Washington.
yes.
Okay.
Okay. But for the
I had,
client, correct?
oh, you're breaking up, Kath. What?
I said for the
Say it
most
again.
part, pretty compliant.
Yes, for the most part. correct.
Yeah, I had a couple Kath friendlies. Do you think we ought to put them on the list?
I do have a planned scheduled reinspection with them at the end of this month, which is on the 20th of November is my reinspection with them. So there will be an update on next month's report. For friendlies.
Okay. And how about the gyro and kebab house?
I did the reinspection last Friday. And they did correct all the items you see here that they were non-compliant with during the routine inspection. So I did go last
Okay.
Friday. It didn't make the report because the report went out on Tuesday. So, but there's no further action necessary for that location.
Okay, did we get the certified anti-choke certificate yet?
He did find his. The person in charge did have one when I was there. However, when he's not there, somebody else has to be certified. So they are working on getting a class, an on-site class, to get several of the staff members certified.
Okay, okay.
Angelo, I do have a question in regards to our classes. Obviously, we're not having correct because the town hall is closed.
Right.
So that'll be,
Do you mean for the workshops or the anti-choke?
oh,
Well, yeah, the workshops, we're no longer doing the free workshops. Those have been indefinitely, those have been postponed because of COVID, obviously. As far as the anti-choke training, Beth, who is one of our companies that we recommend our operators use to get certified anti-choke, she does hold classes. I believe she does them at a restaurant in Newton. She no longer does them at the town halls in Framingham and Newton because I believe they're close to the public. But she does hold the classes at a restaurant in the town of Newton where people can go to. And she also does on-site classes where an operator in Norway can call her and schedule a class on-site in their restaurant.
Who's that, Beth Olson? No.
Correct.
Beth?
Yes.
Yeah.
okay, good. Any other questions on the inspection report?
nope, thank you, Angelo.
Thank you,
Okay.
Angelo.
Oh, you're welcome. I just want to update the board on a couple of things real quick.
Sure.
I've begun to join the calls with the state, with the local boards of health on Tuesdays and Fridays. They do have a lot of updates on the restaurant standards. And they have a lot of people ask questions about clarification of some of those standards. So those calls are helpful to me when I get to join them. And we also had our virtual conference, the Massachusetts Health Officers Association conference. We had them the last 3 Wednesdays in October, which I did attend. It was done virtually, obviously, this year. So it was a little different. But I think that is all I have.
Thank you.
Okay.
Thanks. Okay, Sigal, you're in for your director's report.
So a lot of it overlaps with what we already talked about with COVID. I outlined the changes in the new orders, and I think they were attached in your packet to the actual orders, if you want to read them through. I did want,
If you have a night that you can't sleep, yeah.
yeah, a lot of whereases. I did want to note that our weekly data report is now going to be issued on Thursday, assuming the state comes out with their report on Thursday. Last week they delayed it to Friday, so ours was delayed. Just so the public knows, we have to wait till the state issues their report because a lot of that information goes into our weekly data report. So if there's a delay with that, there's obviously a delay with ours. But the plan is that it comes out by 5 p.m. on Thursday. So ours is usually up by 6 or 7 p.m. on Thursdays. And I do put the testing data, percent positive. I do put our average daily case count. Like I said, the percent positive is based off of the state report. We don't have access to that data locally, which is a little bit of an issue. So that means at this point, we won't know if our percent positive goes over 5 until everybody knows. which is a little bit of an issue, which we've obviously had communicated with the state that we really need to know that data locally. So we are able to react when the report comes out. Angela talked about the calls. We continue to do those on Tuesdays and Fridays. We have calls with DPH where they go over any policy changes on a wide variety, not only the orders, but also whether it be something in Maven or new information about COVID, new research out there. So they're always sharing information.
They change that fast, Gal? They go from Tuesday to Thursday? Things could change?
Oh, that's for sure. Yes. And you know, it's tough. Like on our Friday morning call, we were just told to watch the governor's press conference, and that's when they changed the whole metrics, which had huge implications for communities. So a lot of the time, again, more for the public here, we find out when you find out.
Oh, that's a shame.
Makes, you know, it's very difficult. So you know, halfway through the press conference, we're already getting emails and phone calls with questions. But we're just absorbing the information and have to, you know, figure out how we implement it on the ground. So just as everyone knows, be a little patient with us, and most of the community is. We also continue to meet with our larger emerging preparedness region. We are also ordering some supplies. There was some funding available to get some COVID supplies and some flu clinic supplies, so that's a big help. And I continue to meet with the Coalition for Local Public Health. We actually meet weekly, and that's when we are able to advocate for local health to the state directly. We have a weekly call with them, and these are the leaders of MHOA, Mass Health Officers Association, Mass Association of the Health Board, Massachusetts Public Health Nurses Association, see if I get them all, Massachusetts Environmental Health Association, and Massachusetts Public Health Association. So there's 5 organizations. Oh, and Massachusetts Western Mass Public Health Association.
How about MAHB? How about MAHB? That involved?
Yep. Yeah, I got that one second. Right after MHOA. Cheryl is on them, as well as Mike Hugo and blanking, the Harvard professor. Anyway, there are 3 people from MAHB.
Yeah.
Marcia Testa.
Okay. Yes.
And then lastly, we also have our NC8 Regional Coalition, which is a smaller group that we're able to partner with a lot, and that's who we're doing the assessment on shared services with, and we continue with that, and we coordinate our medical reserve corps through them also. So continue to do all those things. And I also do want to mention we are in the process of renewals. So Jen is working very hard to get all our renewal applications out, and those are coming back in now. And remind everybody that does have a permit to make sure to get that application in before the end of November, because otherwise there's a late fee.
Okay. How often do you meet with all the boards, Sigal? Did you say once a week?
We meet every Monday.
Every Monday. Okay.
Yep, once a week.
Sigal, I have another question. I'm sorry, I turned over the paper for my scribbling notes. Go back to COVID for just one question. When we do our, let's see how I can explain. So when we do our count, is it within a range of dates? Is it a widespread? Is it the month? Is it 2 days? Is it 5 days? How many days does that total involve?
Sure. So you're talking about the average daily case count per 100,000, right? That number that indicates the color. That is a 2-week period. So it runs from Sunday to the 2 Saturdays. So this week's report will encompass October 25th to November 7th, and it'll come out on the 12th, November 12th.
And then
so
we start again the count, right?
Yep. And then the following report would be Sunday the 1st to Saturday the 14th, and that would come out on the 19th. So you are a couple days behind. But the testing data really takes that. So somebody that gets tested on Saturday might not get the reports till Tuesday, Wednesday. So, it kind of captures the cases that happen in those 2 weeks, even though the report might come back after that time. It's based on the date that you get the test.
Okay, that's some people have asked, what range is it? How many is it? Is it 30 days? Is it 3 days? It's good for the town to know, in our townspeople, all these things. So nobody is panicking. They can look at a range and figure it out. Thank you.
Yeah, and really, there's a wealth of data on our weekly data reports. I do talk about, the age breakdown, which we're seeing much younger now than we did in the spring. I do take I take the total age breakdown, and then I compare it to the last 30 days, so you can sort of see what's more current, what's the current activity, and continue to see lower ages, which I think is leading to less severe disease, which is a good thing.
Thank you very much.
Are they finding any in the preschool age, Sigal, as much as everybody thought they were going to, like childcare?
I wouldn't say a lot. We've had a couple. I think the range from last year's report went from 2 to 95, so that was a pretty big range. But again, I think the average was about 35 or 37. So most of the cases tend to be 20, 30, 40-year-olds. But every once in a while, we do see someone preschool age and younger. I think we had, like I said, a 2-year-old last week, but not a lot of them.
Okay, okay. That was my concern, was the childcare aspect of the community and on how that was faring. Okay.
And I would say, just like with schools, same thing with the few daycare age cases or childcare age cases we've had. It's because of household contacts or exposure outside of the facility. We're not seeing, large clusters in any of our daycares at this point.
Good. Okay. Thank you.
Okay. Before we go on to the board's agenda, Stacy, do you have anything you'd like to add?
No, I don't want to be repetitive. Basically, it's all hands on deck with COVID, and we do a lot of the same things. So there's a lot of overlap. A lot of overlap with the nurses and what they do, and a lot of overlap with the director's report. Same types of meetings. Speaking with the school committee, and the superintendent and the chair of the school committee, and just a lot of policies and answering questions for the public and employees. And so I don't want to be repetitive and go through all that again.
I just don't want to leave you out.
Oh, that's okay.
Katie, do you have anything you'd like to add? I know yours might be repetitive too, but I don't want to leave you out.
I think Katie signed off. She had some cases she had to get to.
Okay, that's fine. Board's agenda. Carolyn, do you have anything?
Oh my God, I think I handled everything on my paper. Thank you so much. Thank you for everybody being so patient with my questions. But
okay, Joan?
No, I'm all set, Kathy. Like Carolyn, I asked him as I went along, so everything looks good. You guys are doing an awesome job. We have to thank you so much for, taking care of what we have to, deal with and whatnot. It's appreciated. Let me just say that. It is appreciated.
As it changes daily. It's a lot of work.
Yes.
Thank you all.
And
Okay.
Same goes here. I appreciate everything you do. You're really working hard. I'm amazed that you're all still employed there, that you haven't quit yet. I'm sure. I'm sure there have been many a day when you. Oh, okay. Do we want to make a meeting for January, or do we want to wait until after the December?
Why don't we wait and see, and maybe we can get together in person for a change, huh? That would be nice.
Unlikely, Joan.
I'm going to say probably not.
I see them all shaking their head no. Okay. Yeah, if you want to make a meeting, that's fine, Kathy. Doesn't matter.
We can wait until December.
Okay.
All right. Someone want to make a motion for adjournment?
Like to make a motion that we adjourn the meeting, please.
I second it. Thank you, everybody.
Thank you. All in favor?
Aye.
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 Okay, meeting adjourned.